Welcome to Anatomy of Abdomen. So in the first session we would learn about the surface anatomy of abdomen. So let us see some landmarks in abdomen. The first point is the Murphy's point. It lies below the right costal margin in the mid-clavicular line. So to note the Murphy's point, it is first we have to draw the mid-clavicular line. So we put a point over the midpoint of the clavicle. A vertical line drawn along the midpoint of the clavicle is the mid-clavicular line. So here the dotted line is the mid-clavicular line, and it is present in the right costal margin. So here is the costal margin. So this point is the Murphy's point. So the Murphy's point is it is a landmark for the approximate location of fundus of gallbladder. So we can see the fundus of gallbladder here. So which is an approximate location for the fundus of gallbladder. So the point is at the intersection of right linea semilunaris and right costal margin at the tip of right ninth costal cartilage. So it is the point of intersection of right linea semilunaris. So linea semilunaris is the lateral border of the rectus sheath. So along the lateral border of the rectus sheath, that is the linea semilunaris, which is along the lateral boundary of the rectus abdominis muscle and at the tip of right ninth costal cartilage. So the costal cartilage which is associated here is the ninth costal cartilage, means here. So that is about the Murphy's point, and the most important thing clinically in acute cholecystitis, when anterior abdominal wall is pressed at this point, the patient winces while taking a deep breath due to pain. So that is the point of tenderness in acute cholecystitis. So next point is the McBurney's point. It lies over the right side of the abdomen at the junction of medial 2/3 and lateral 1/3 of the line joining the umbilicus with the anterior superior iliac spine. So here is the anterior superior iliac spine and here is the umbilicus. And if we join these 2 points, the junction between medial 2/3 and lateral 1/3. So here medial 2/3, lateral 1/3. So this point is the McBurney's point. So this point corresponds to the most common location of base of appendix. Base of appendix is the point where the appendix is attached to the cecum and is the site of maximum tenderness in acute appendicitis. Okay, next point is the mid-inguinal point. The mid-inguinal point lies at the midpoint of a line between pubic symphysis and anterior superior iliac spine. So here is the pubic symphysis and anterior superior iliac spine. So midpoint between these 2 points is the mid-inguinal point. In adults, it approximates surface marking of the femoral artery which lies just below the inguinal ligament and a deep inguinal ring just above the ligament. So just below this mid-inguinal point, it is the surface landmark for femoral artery, location of femoral artery in adults. And above to the mid-inguinal point is the location of deep inguinal ring. So next is the location of deep inguinal ring. Deep inguinal ring is an opening in the fascia transversalis approximately midway between the anterior superior iliac spine and pubic symphysis and 1 centimeter above the inguinal ligament. So this is the anterior superior iliac spine and here is the pubic symphysis. So we know this is the mid-inguinal point. So the next surface marking is the transpyloric plane, which is located at the lower border of L1. So this is L5, L4, L3, L2, and here is the L1. So if you draw a horizontal line along L1, that is the lower border of L1, indicates the transpyloric plane or adjacent plane. So we say it as transpyloric plane because the pylorus of the stomach is located at the level of transpyloric plane. So this is the pylorus of stomach. Transpyloric plane, which is otherwise called as adjacent plane, lies midway between the suprasternal notch. So this is the suprasternal notch of manubrium. Here is the suprasternal notch. So from suprasternal notch, we have to draw a line till the upper border of pubic symphysis. So the midpoint over this line indicates the location of transpyloric plane. Otherwise, we can say that this plane corresponds with approximately the midway between the umbilicus and the xiphisternal joint. So the location of the umbilicus is between L3 and L4 here, and here is the xiphisternal joint. So the midway between the umbilicus and the xiphisternal joint roughly indicates the location of transpyloric plane. Posteriorly, the plane intersects with the lower border of L1 vertebra. Anteriorly, it intersects the costal at the 9th costal cartilage. So it intersects with the 9th costal cartilage. So a line drawn along the 9th costal cartilages, touching both the 9th costal cartilages, is the transpyloric plane. It is the key plane of the abdomen as it corresponds to number of abdominal viscera. Let's see the structures which lie approximately within the transpyloric plane. Origin of superior mesenteric artery, origin of portal vein, which from the confluence of superior mesenteric and splenic veins behind the neck of the pancreas. Next is the hilum of the left kidney, which is also located in the transpyloric plane. The hilum of the right kidney is slightly lower. Origin of the renal arteries, duodenojejunal flexure, termination of adult spinal cord, pylorus of stomach. Pylorus of stomach is not a constant feature in the transpyloric plane. Linea semilunaris, it is a curved furrow which extends from the tip of the 9th costal cartilage to the pubic tubercle. So here is the 9th costal cartilage. So from here till the pubic tubercle along the lateral border of the rectus abdominis. So this one is linea semilunaris. So linea semilunaris lies few centimeters away from the median furrow and corresponds to the lateral margin of rectus abdominis. So the next important landmark is the subcostal plane. Subcostal plane is located along the upper border of L3. So L5, 4, 3. So along the upper border of the L3 is the location of subcostal plane. It is an imaginary horizontal plane which passes immediately below the costal margins. It passes anteriorly through the lowest borders of costal cartilages of 10th rib and posteriorly through the body of L3 vertebra. So above the body of L3 vertebra and along the costal margins, that is the 10th costal margin, is the subcostal plane. Transumbilical plane, as the name suggests, it is the plane which is crossing the umbilicus. So this transumbilical plane, it lies between L3 and L4. So between L3 and L4 vertebra, and it is a transverse plane that passes through the umbilicus or at the navel and lies at the level of intervertebral disc between L3 and L4 in normal healthy individuals. And this location may change, that is the transumbilical plane may be different and variable with different individuals, especially in those who are having pendulous abdomen. It may not correspond with L3 and L4 vertebral levels. Transtubercular plane, the plane which corresponds with the upper border of lumbar fifth vertebra. So this is L5 and here is the sacrum. So along the upper border, if we draw a horizontal line, is the transtubercular plane. It is an imaginary horizontal line which joins the tubercles of iliac crust. So here are the tubercles of the iliac crust which joined by the transtubercular plane, and it is palpable 5 centimeters posterior to the anterior superior iliac spines and passes through the upper border of L5 vertebra. So 5 centimeters posterior to anterior superior iliac spines. So that is how we locate the transtubercular plane. Interspinous plane is located along the body of S1. So just below the transtubercular plane, along the body of S1 vertebra, if we draw an horizontal line, it is interspinous plane. Regions of abdomen. The abdominal cavity is conventionally divided by the clinicians into 9 quadrants. This facilitates the description and position of the organs present in the abdominal cavity during examination. These planes are used to delineate the 9 regions or 4 quadrants of abdominal cavity, which the clinicians refer to describe the location of abdominal viscera and pain in the abdominal region. So these regions are bounded vertically by 2 midclavicular lines and horizontally by subcostal plane and also transtubercular plane, below by transtubercular plane, which is located at the level of L5. The abdomen can also be topographically divided into 4 quadrants, namely the right upper quadrant, right lower quadrant, left upper quadrant and left lower quadrant. These quadrants are bounded vertically by the median plane and horizontally by the transumbilical plane. So dividing the abdomen into 4 quadrants by a vertical median plane running through the umbilicus and transumbilical plane which runs between L3 and L4. Dividing into right superior, right inferior, left superior and left inferior quadrants. So let's see the abdominal regions and their main contents. So we said initially the abdomen is divided into 9 regions by 2 vertical planes, which are the midclavicular lines, and 2 horizontal planes. One is the subcostal plane, the other is the transtubercular plane. So first region is the right hypochondriac region. So this is right hypochondriac region where the liver, gallbladder is located in the right hypochondriac region. Epigastric region. Epigastric region is in the middle, above the umbilical region. Epigastric region is associated with the stomach, pancreas and duodenum. So deep to epigastric region we can see the stomach and pancreas and also the part of duodenum. Left hypochondric region. Hypochondrium. Hypo means below, chondrium means cartilage. So it is present on the left side below the costal cartilages. So it is called left hypochondric region. It is related to spleen and left colic flexure. Right lumbar region. Right lumbar region is related to right kidney, right ureter, ascending colon. Umbilical region. So in the middle where the umbilicus is located is the umbilical region, where the loops of the small intestine, aorta and inferior vena cava are related in the umbilical region. Left lumbar region. Left lumbar region. Left lumbar region is related to left kidney, left ureter and descending colon. Right iliac fossa. Right iliac fossa is related to cecum appendix on the right side. Hypogastric region. So below the umbilicus, in the middle is the hypogastric region. Coils of the small intestine, urinary bladder if distended and uterus if enlarged. So in these cases they are related to hypogastric region. Left iliac fossa is related to sigmoid colon. So these are the regions and viscera which are related to these regions in surface anatomy. Thank you. This completes the surface anatomy of abdomen.